As we age, the risk of developing osteoporosis increases. Having weak bones that are more susceptible to fractures and breakages is a symptom of the condition. 50% of women and 20% of men will break a bone due to osteoporosis in their lifetime, according to the Royal Osteoporosis Society. But knowing the signs and adjusting your lifestyle appropriately can help to manage and prevent osteoporosis. Here is a list of the most vital information surrounding osteoporosis to help keep strong bones and reduce the risk of fractures later in life. Bone scan of the entire body. Photo by BSIP/Universal Images Group via Getty Images. Image, Getty, 1. It is often referred to as the silent disease. It is often called the silent disease because it progresses without symptoms until a fracture occurs, explains Sam Bidet, physiotherapist and founder of Physios Unlimited. Kirsty Carney, senior osteoporosis specialist nurse at the Royal Osteoporosis Society, adds, "It doesn't cause any general aches or pains or other symptoms. It's the broken bones that can cause pain, rather than osteoporosis itself." Spinal fractures can also cause height loss and a curved spine. 2. The condition is more common in women. Women have smaller, thinner bones, low bone mass, compared to men, highlights Bidet. And estrogen, which protects bone density, declines gradually after menopause, accelerating bone loss, making women prone to bone density issues. Pregnancy and breastfeeding can also temporarily deplete calcium levels. 3. People with osteoporosis can break bones through minor activities. Osteoporosis is a condition where the bones become weaker and break more easily, even after a minor bump or fall, explains Carney. Broken bones, called fragility fractures, caused by osteoporosis can commonly affect the spine, hip and wrist. People with osteoporosis can break bones through really minor daily activities such as moving a pot in the garden or bending to get a casserole out of the oven. Age and family history can impact your risk of developing the health issue. Image, Getty, 4. There are many risk factors. Your age as well as your family history can both heighten your risk of developing the condition. Bone density naturally decreases with age and genetic predisposition plays a role, says Bidet. Lifestyle factors can also have an impact on your risk of osteoporosis. Poor nutrition, especially low calcium and vitamin D intake, can increase the risk, says Bidet. Smoking and excessive alcohol consumption are also risk factors that lower bone density. 5. Early diagnosis is important. Early diagnosis prevents fractures and associated complications, and also allows timely interventions to slow bone loss, says Bidet. It also reduces healthcare costs and improves quality of life. Usually, the condition is diagnosed following the bone density scan, DXA scan, of someone with a high risk of developing the health issue. This scan helps us understand if you have a raised risk of fractures and if you will benefit from being on one of the drug treatments for osteoporosis to reduce that risk, explains Carney. For some elderly people who have broken a hip, or had several fractures, their history of broken bones may be enough to highlight a need for treatment without having a bone density scan. Vertebral osteoarthritis with osteophytes, bone spurs, seen on a frontal CT scan of the lumbar vertebrae. Photo by BSIP/Universal Images Group via Getty Images. Image, Getty, 6. A healthy lifestyle and diet can help to maintain good bone health. A healthy varied diet that provides all the nutrients you need, and plenty of exercise can help to keep bones stronger, says Carney. Make sure you have at least 700 mg of calcium daily and consider using 400 international units of vitamin D a day during the winter months, as these are both important for bone health. Also, simple things like avoiding smoking and keeping alcohol levels within recommended limits can help to reduce your risk. These things can't stop all chances of osteoporosis and fractures, but they can help to reduce your risk. 7. Bone strengthening exercises can reduce the risk. Regular weight-bearing and resistance training 3 to 5 times a week can help, says B-Day. Bones stay strong if you give them a variety of work to do, says Carney. Aim for 150 minutes of weight-bearing exercise a week, recommends Carney. For exercise to be most effective at keeping bones strong, you need to combine weight-bearing exercise with impact such as jogging or stamping, and muscle-strengthening exercise such as lifting weights or using resistance bands. 8. There's no cure for osteoporosis. We don't have a medication or treatment that will get rid of the condition completely and make your bones healthy for the rest of your life, says Carney. We do, however, have medications that can help to strengthen your bones and reduce your risk of fractures, and these work really well. For most people with osteoporosis, this means they may be on a drug treatment for a few years, and may be off for a year or two, and then back on again if their bones start to deteriorate again, and so on. There is a range of drug treatments for osteoporosis, including tablets, injections and intravenous infusions, but most people will use a tablet they take once a week, such as alendronate. Join the Daily Record WhatsApp community. Get the latest news sent straight to your messages by joining our WhatsApp community today. You'll receive daily updates on breaking news as well as the top headlines across Scotland. No one will be able to see who is signed up, and no one can send messages except the Daily Record team. All you have to do is click here. If you're on mobile, select Join Community and you're in. If you're on a desktop, simply scan the QR code above with your phone and click Join Community. We also treat our community members to special offers, promotions, and adverts from us and our partners. If you don't like our community, you can check out anytime you like. To leave our community, click on the name at the top of your screen and choose Exit Group. If you're curious, you can read our privacy notice. Don't miss the latest news from around Scotland and beyond. Sign up to our